who is Chairman Health Committee of Parliament. Thank you very much for your time and good morning to you, sir.
Good morning.
Doc, I hope you're well.
Oh, by God's grace, I'm fine.
Doc, the nurses accuse you of bad faith, that you should have notified them ahead if you knew the meeting was not coming on and not give them a last-minute notice that the meeting was not going to happen. How do you respond to that?
I will say that they should exercise patience and that the health committee also did not know that the meeting cannot come on. And so it was confirmed to us, yes, that was on the 25th of June.
So, hello, Doc, can you hear me?
Yes.
Okay. I heard some cuts in your line, but you're saying that even you were not aware until the last minute.
Yes.
Who are the six stakeholders who are not in town currently?
Currently, the Minister of Health and then the Minister of Finance are all on official duty outside the country.
Now, the date you have scheduled for the meeting, the rescheduled date is 10th
Yes.
July.
Yes.
Do you have guarantees from these people that they will be in town for that meeting on the day in question?
I'm hoping that we'll come to the conclusion before the 10th of July. And the 10th of July will be a day that will probably communicate to the nurses, but we should be able to resolve the issue. I'm saying this because when we met on the 12th of June, the conclusion was that the finance ministry was going to carry out an economic and financial impact analysis of their demand. In other words, they were going to turn the four things that they tabled before their employers to money. In other words, in monetary terms, how much it will cost the nation. And you know we are under IMF. I don't want to go into details about that, but for example, the IMF says that if you don't budget for something, you cannot spend. That is one of the conditionalities, which as a nation, we have all signed to. So we need to convert it into money and see how best it can be implemented. And as I speak now, that analysis, to my understanding, has been done. But it has not yet been communicated to the finance minister and then the Minister of Health. And so without these two people actually knowing about it and drawing a conclusion, we couldn't have held the meeting in their absence. And that's why the meeting had to be postponed.
And I'm guessing that your attention has been drawn to the press conference that was addressed by the president of the Ghana Registered Nurses and Midwives Association. Have you seen it yourself?
Yeah, yesterday I monitored the press conference.
What are your impressions?
First and foremost, let me use the opportunity to thank the nurses for their understanding and cooperation. They were straightforward. Yeah, they will come for the 10th of July meeting, and they still have their four demands that they have tabled before us, and they'll be coming to hear what the government has to say about it.
But that's not the impression we get from listening to them. It seems they are saying, we're giving you four demands. We expect that those four demands will be implemented from July. And we will not, and the other 4 should be implemented no later than January 2026. So it seems their minds are set that they are not ready to negotiate implementation date or anything.
I don't want to sound controversial, but the Ministry of Finance requested to do this analysis. It is only fair that we wait and listen to them. They have the data. They have the primary data, which they can refer. The payroll is with them. The numbers are with them. Whatever they are paying is with them. And it is only fair that they carry out the analysis. And after that, then we should be able to speak. There's a saying that if you know something and you can measure it, you can express it in numbers, then you know what you are talking about. But if you know something and you cannot measure it, you cannot express it in numbers, then your knowledge about that thing is that of unsatisfactory kind. So let us wait. Yes, they've converted it into numbers. Let us hear them. Yes, so I'm pleading on behalf of government that the nurses should exercise patience. I know that it is sometimes not easy to be leaders to a large group like 120,000 nurses. Yes, but we so far had their cooperation, and I hope they will continue to cooperate.
So you're hoping that the stance taken at that press conference will not be taken into the meeting?
I have not seen any stand as such. Probably it's those who are doing the commentary. But I listened to it personally. And they were ready to meet us on the 10th of July and listen to whatever we have to say.
In the meantime, do you get the impression that there's some bad faith between them and their sector ministry, the health ministry? Because they keep saying that they only called off the strike because of you. Those of you in parliament, the parliamentarians.
Yeah, communication had broken down. And as you may have noticed, they were not making progress. But as I speak now, we have made progress. And the progress is that their demands are now numbered. And their demands, as I speak now, have been converted into numbers, into monetary terms. And that will make the conversation easier. Yeah. We will not be talking about numbers. Yes.
Doc, thank you. Thank you very much for speaking to us.
Okay, thank you too.
Dr. Market Nawaane is chairman, Health Committee of Parliament. He has the difficult job of ensuring that he tries as much as possible to use the platform to get a resolution that is in favor of everybody, that everybody's happy about, and this matter is resolved once and for all. Because it seems they have the ear of everybody, our representatives in Parliament. And there's one thing that, of all the things that I've heard, there's one thing that I'm happy to hear, that the nurses keep saying consistently, that we are listening to the members of Parliament. And I think that's that we are listening to the representatives of the people. That no matter what what the situation is, they are ready to give an ear to the reps of the people. Well, so we are watching that. Don't forget that meeting is 10th July. And you're still sending your commentary. Well, a few things. First,